Hello, my name is Haley Stewart.
And my name's Doug Siegmund, and today we're going to talk to you about a healthcare problem that many people wouldn't think about is costing the healthcare system millions of dollars per year, but it actually is. Both of us found this topic very interesting because not only do we find epidemiology fascinating, but we also find healthcare statistics is a field that is often overlooked when it comes to the care in emergency departments around the country. This problem, which has been prevalent for many years, is that patients are seeking health care in emergency departments, but they only have minor injuries, and they should attend a different healthcare facility like an urgent care or actually see a specialist. This problem, which is costing the U.S. so many millions of dollars per year, is minor eye trauma. And the full source can be found in the link section or the comment section below in our video.
According to the National Hospital Ambulatory Medical Care Survey, only around 56.5% of all visits to the emergency department were actually categorized as emergent or urgent. This means that the amount of people who are admitted to emergency departments may be able to seek treatment at another medical resource. One of the pathologies that is contributing to this overuse of the ED is associated with eye care. In 2008, it was reported by the nationwide emergency department sample that 636,000 people were admitted as patients in the emergency department for eye injuries other than actual trauma. Eye care is normally treated as an outpatient process in a specialist office. This is done because the amount of ophthalmologists are few and far between inside of an emergency department. The nationwide emergency department sample was used for this study specifically because it is one of the largest databases in the U.S. that helps provide statistics for the U.S. Agency for Healthcare Research and Quality.
The researchers for this study identified all patients from hospitals around the United States from 2006 until 2011 that were admitted to emergency departments that were related to the eye. Specific codes to identify if pathologies were related to the eye were used by the International Classification of Diseases, 9th Revision Clinical Manifestations. Categorization was also made to determine if the eye problem was an immediate threat to vision or if it could have been managed in an urgent care or eye clinic setting, essentially non-emergent settings. More than 90% of patients were discharged from home after presenting to the ED. Of the 200,604 patients that were admitted, the age group that was admitted most frequently was the elderly, which is ages 65 and older, which accounted for 27.3% of all admissions. The leading diagnoses that resulted in hospital admission were orbital cellulitis, which was 15.5% of all admissions, orbital floor fractures, which were 12.5% of all admissions, and eyelid abscess, which was 6.9% of all admissions. And just to show a chart that relates to our information here, I'm going to show you this. And basically what this is this is from the CDC. Let me get this in here. And it says, in case you can't read it, it says rates of treatment and release ED visits related to eye injuries were highest for 18 to 44-year-olds, while rates of ED visits related to eye injuries resulting in admission were highest for patients 65 years and older in 2008. So as you can see up in the diagram at the top, there's a little red that's surrounding the blue, and that says to treat and release ED visits related to eye injuries, and that's represented right here on each side of each column. It's kind of hard to see. And then we have ED visits related to eye injuries resulting in admission, and that's just these top columns right here of those. It's easier to see on that one. And then we have just the red line with the triangle, and that says ED visits for non-eye injuries. So as you can tell, that this chart is proving that yes, granted the age range is much higher for emergency departments, but people who are actually admitted to the hospital for eye trauma is the elderly, which is shown right here up at the top. And then compared to regular just diseases from admittance to hospitals.
The leading mechanism of injury, accounting for 29.8% of all injuries, was accidental entry of a foreign body to the eye and adnexa. The second most common cause was being struck by or against persons or an object, which accounted for 18.4%. More than 4 million ED visits occurred for conjunctivitis, subconjunctival hemorrhages, and styes. Non-emergent care costs 2 to 3 times more when provided at EDs compared with similar visits in other settings, and ophthalmic care is no exception to the rule. A very strong point of the article is that it captures the exact statistical sense of the amount of money that it is costing our healthcare system every year to serve people without serious injuries being admitted to EDs, when their care can and should be taken care of at a specialist office. I just have a diagram here of the eye, and we're just trying to demonstrate with this, showing you what the 4 million patients that are admitted every year to the ED are suffering from. It's just conjunctivitis being the first one, which is just an inflammation of the conjunctiva, which is the outer membrane or inner membrane of the eye. And then also subconjunctival hemorrhage, which is the bursting of blood vessels, bleeding underneath the conjunctiva. Excuse me, sorry, I'll hold that from the top from now on. And then the last thing that they come into the ED for is styes, which are small glands that line the eyelid, well, not shown on this picture, but the eyelid, that get plugged and can appear as like red, full, painful lumps, which can be compared to like a boil or a pimple. And these are the minor injuries that many people come into the ED for that they could have sought treatment at a specialist or an urgent care for.
One of the limitations of our study is in the assessment of the cost of ED visits. A source that we use provides hospital charges with no charge to cost conversion to ED visits. Thus, the hospital charges described in our study reflect the total ED related charges, but not the final cost to the patient, physician, or hospital for these visits. Another limitation that the study fails to mention is the Emergency Medical Treatment and Active Labor Act, which is also known as EMTALA, which entitles people not to be turned away from any emergency department for any reason. But we digress, that is not the point, and the goal of the study was conducted.
The hypothesis that was under investigation was that if people continue to use EDs as a means for minor eye trauma, will this cost the healthcare system more money every year? The data for this research article was collected from the nationwide emergency department sample, also known as NEDS. NEDS is the largest all-payer ED database in the United States. It is a federal state industry partnership sponsored by the U.S. Agency for Healthcare Research and Quality. NEDS provides national estimates of emergency department visits for all ages and allows analyses of patterns in the use of ED services. NEDS gathers its data from the billing records of the 25 to 30 million emergency visits that occur each year from more than 950 hospitals.
One of the major findings of the study was almost half of the cases proved to be non-emergent. A tremendous amount of money could be saved if these patients with conditions that show no threat could be managed at eye clinics or walk-in facilities across the country. The cost of care for conjunctivitis, for example, is estimated to be $390 in the emergency department versus $101 in an urgent care center and $136 in an ophthalmologist's office. This finding supports that the hypothesis it proves that non-emergent eye-related ED visits are costing the healthcare system more money than they should. These findings point to future studies because they have given us a problem. However, we need to research it further to develop an effective solution.
We chose this particular article to review because before coming across it, neither of us had realized that the cost of in an emergency department of care is significantly greater than the care given in an urgent care or a doctor's office. We also had not realized the major negative effect that this influx of non-emergent patients is having on EDs across the nation. We believe it is important for us as healthcare professionals to be fully aware of the problems that exist in our field of work so we can try to fix them. Overall, we feel the research article was well written and very informative. All the data was easy for us to interpret, and the correlation between the data and the findings were displayed clearly throughout.
So in conclusion, in reading this article, we have learned about the prevalence of non-emergent eye-related ED visits and the ways in which it is negatively affecting the healthcare system as a whole. Emergency departments were developed to treat emergencies and therefore should not be compromised because of non-emergent issues. Furthermore, the cost of care in an emergency department is significantly greater than that in the doctor's office, so it should be strictly limited to actual emergency situations. We believe it is important to look at this from the big picture and realize that this study only showcases the effects of eye-related non-emergency ED visits. In reality, these non-emergent trips to the ED are not just limited to eye problems. If you factor in all the other types of non-emergent ED visits that are occurring, it paints a clear picture of how much an issue this is and will continue to be if something is not done to prevent it. Thank you.
Thank you.